Welcome to the Equine Vet Connect Podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect Podcast. I'm Dan Carter. We're here at Countryside Equine Hospital, back in the studio. Got old Caroline Brown, Dr. Brown, with us today. How are you this morning?
I'm great. I'm caffeinated. I'm good to go. Like, the sun is shining.
Yeah, today's podcast, we're going to say, is brought to you by Starbucks, because we've been running on Dunkin', but Dunkin' ain't showing us no love, so.
It's the superior, in my opinion.
You think so?
Yes, I'm a Starbucks girly.
I like both. Mm-hmm. I kind of go back and forth, though.
They each have their own, like, strengths, you know?
I would agree with that.
Yes.
I would definitely agree with that.
Mm-hmm. Like, all my home brewed coffee is Dunkin', but I'm like, if I'm out, I prefer the Starbucks.
Okay, yeah, I will say if I'm getting a cappuccino, I prefer the Starbucks. Mm-hmm. Straight black coffee, I'm kind of a running on Dunkin'. Mm-hmm.
They got the basics down.
True.
They're good.
Disappointing thing, Dunkin' does not make their donuts in the store anymore. They're shipped in on a truck. They're not made in the store.
Really?
Yes.
It's not like Krispy Kreme where they have like the whole conveyor belt system and... No,
this is a really sad day for my kids.
Oh, did you break that to them? It's like telling them about Santa Claus.
They're the ones that found out. They told me.
Oh, they told you?
Yeah.
Oh,
It was kind of sad. They're made somewhere in Indiana now. Shipped in by truck, and it's like...
Every day?
I guess.
Because, I don't know what kind of preservatives they're putting in there to make them taste fresh. They taste like they're that fresh, but I don't know.
Yeah.
Well,
terrifying.
Okay. So, that just ruined my day.
I know. So let's,
Okay.
So speaking of running on Dunkin' and Starbucks, actually, there's not a good way to segue.
No, not really. It was a good try.
It was a good try. I don't even know where that came from, but yeah. So we're back in the studio, Treatment Room 1 here at Countryside Equine Hospital, and today we're back in dermatology land. It's spring.
It is spring.
Spring in Georgia. That means a couple things. One, everybody's got pollen everywhere. Allergies are upon us. We're also headed into hot, humid summers, and this is when dermatologists become legend.
Mm-hmm. This is our Super Bowl.
Yeah, this is the Super Bowl of dermatology for the next few months. So we're going to be talking about bacterial dermatitis. Mm-hmm. I love the title of today's podcast, and I love what we're talking about. Like, it's not a fungus.
Until it's a fungus.
Until it's a fungus.
Until it's a fungus.
I always think about Arnold Schwarzenegger in that movie. I can't remember. It's not a tumor.
Kindergarten Cop?
Yes. All right. I always think about it's not a tumor. Every time somebody looks and says he's got a fungus, it's like it's not a fungus. Because it's not a fungus.
It's not. No, most of the time it is a bacterium.
I think it's less than like 3% or it's something crazy. Like, it's never a fungus.
Well, because when it is a fungus, then we've got a whole...
Right.
Fungi are nothing to joke about. Like, they're very tough. They are very resilient, and they're tough to treat. So
most fungal issues are man-made.
Yes.
It's because you've been doing everything to treat a fungus except treating the fungus. And you've given an opportunity. Like, fungus are opportunistic.
Fungi are like some of the coolest thing,
I'll agree with
honestly.
that.
They are like, they're so fascinating. They're also terrifying. So any fans of The Last of Us out there, if you know, you know. But like, again, like, that show is like my greatest fear in life is just, like fungal zombies, because like we have no good antifungals out there. Like, we don't have a good way to treat them.
I'm thinking like 3, maybe 5 antifungal medications
that are okay at what they do.
Yes.
And there's so much resistance, and there's so much we don't know about them that, once we do have a fungal infection, we're like, okay, we have a couple tools that we can work with, but nothing's really a guarantee. And even if it does work, most antifungal treatments, you're on them for months at a time. Months.
And like I said, most funguses are the result of improper antibiotic usage.
Yes.
Like most fungi that you see are a result of improper. And so let's talk about, let's get into the weeds here. When you're looking at most skin problems and people go out and they see the horse, and I swear if I see one more leg slathered in athlete's foot cream, I'm gonna lose it.
Yeah, lose it.
They're always like, it's a fungus, it's a fungus, it's a fungus. And it's not.
It's not.
95. All right, we're gonna err on the side of safety. We're gonna say 95% of these. Get rid of any rounding areas. Give credit to the fungus where credit is due. 95% of these are bacterial infections.
Yes. So what we have to kind of remember when we're going back to kind of the first episode that we talked about is that the skin has a very unique microbiome in it. There are, the skin is not a sterile surface at all. There are all kinds of, different species of bacterium that live on your skin. And the bacterium that's on my skin is different than the bacterium on your skin.
Correct.
And it's very different than what's on a horse.
Yep.
And this horse to this horse, even if they live in the same place, even if they're related, they're completely different. And so, when you get into some of these bacterial diseases, a lot of them are infectious agents that come in and they, aren't normally there and they infect the skin and all that. But a lot of them are, what we call opportunistic, where you have disrupted that, little ecosystem on the skin, and you've allowed one of these bacterium to take over and grow out of control, and that's what becomes the problem. And so, what we were kind of talking about earlier, where these man-made infections, a lot of these, antifungals, bacterial, everything, shampoos, topicals, whatever, you're actually killing the bacteria that you need.
I think I just thought about this. I think a good way to think about this is if you go out and look at your yard and you've got a beautiful lawn, right? Now, if you go out there and your dog digs a hole in your yard, or if you have to do something to your yard, you've disrupted that layer of grass. Then the weed shows up.
Yes, that's a very good example.
And I just thought about this. If you think about your yard or your pasture, because the grass shields out the ability of those weeds to grow, and that's like our normal bacteria, our normal flora on the skin. And it's when you have a disturbance in that, the weeds start to grow in the lawn. Well, guess that when you get a disturbance in that normal flora, that's when these nasty bugs, the pseudomonases, the nasty enterobacter, some of these staph and streps, that's when they grow. And so, it's when you disrupt that microbiome. And a lot of times it's, never mind. You keep going. I get excited. This is a topic I'm really passionate about because one of my big things on it is we're always talking about antibiotic resistance to medications. And I think some of these topical skin issues, some of these skin treatments, I think that's where some of this resistance starts because we just keep slapping it on there. And it never fails. When we finally, on some of these, when we actually get there, we've got a multi-drug resistant bacteria. But I'm jumping ahead. Let's start back. Yeah. Keep going. I'm getting a little, I get excited.
You're getting excited.
I do. I like derm.
This is an exciting topic.
I love lameness and I love derm. Which makes no sense.
I think I told you about this topic a while ago, and you were like, "Oh, I want to do that one."
I know. You would think I love it. I love derm. All right, keep going.
So I think one of the big examples we can talk about where this is super relevant is scratches. Yes, and that's super common at this time of the year. Yep. All the moisture, all the turning out, and all that. But so scratches basically is a fancy word for pastern dermatitis. Yep. It's kind of our layman's term. So dermatophytosis. So basically what this is a bacterial infection on the back of the pasterns. I'd say, really common in all horses. I mean, I think if any horse steps outside in a slightly damp environment like it is today.
It's dew.
Yep, dew poisoning.
Yep.
That's the other,
Forgot about dew
layman's
poisoning.
term.
Yep, dew
Dew
poisoning.
Yeah, I don't hear that one as much these
That's
days.
a Kentucky word. You get that dew poisoning.
The dew poisoning, okay.
They poison by that dew. So, yeah.
But what this is basically just a bacterial infection in that area of the skin. And it can be super itchy, it can be super painful. Well, I've actually seen some lameness issues that have come from this.
Crippled.
Crippled, yes.
I think and what I've seen is it's normally the horses, like when you see them standing there and they've got the folds in the pastern, and they've got more of those folds in the pastern. It's because those bacteria can hide in there.
Yes.
It gets wet, it gets damp, it gets moist, and then we have this overgrowth, this dermatophilosis, this huge overgrowth of bacteria in there,
Yes.
and crippled.
And our feathered friends are going to be much more prone to this as well.
Yes.
So our draft horses, anybody with long feathers, because what all that hair does is just trap all of that moisture in there
Yes.
and creates, a little sauna for all this bacteria that they love, and it's just going to make it worse and worse. So,
Right.
Kudos to all the, people out there that have draft horses and, know how to manage all that, because I'm like, ugh.
Well, and this is the result of setting up or messing up that microbiome because it gets a little wetter than it normally is. And so our good bacteria that are normally in there protecting us, it gets too damp for them to function, and they kind of drop back, and then this opportunistic bug's like, and today's the day. They've let their guard down.
Yes.
So,
yes.
And so really it becomes about that environmental management. How do you manage that environment so that our good bacteria can go kick the butt of our bad bacteria? Because it's really like a little battle down there, like good versus evil in bacteria.
And I mean, anybody who's ever had this on their horse knows the frustration of it. And like once you get it, you've entered this like cycle of trying to treat it. I mean, one of my horses had it when I was growing up, and I feel like it was every spring like clockwork. I'm like, oh, here we go. And it's always the white foot. I don't know why.
It truly is.
It's always the white foot.
Yes.
Yeah. His other foot was fine, but it was always his white foot.
Yeah.
But yeah, so what I do for treatment with these is there's kind of multifactorial. So, you've got your local treatment, and then you've got your systemic treatment if you need it. A lot of these times, if we catch them early, if we can get them under control, local treatment's going to be really easy to do. And that's where, talking about these shampoos comes in. So, if you go to Tractor Supply today and you start looking around at all the shampoos, you're going to see all kinds of, antimicrobial, antifungal, antibacterial, all these anti-everythings on there. And those aren't necessarily bad.
They're not bad.
No, they're not necessarily bad. They're not all evil, but you have to be very careful with those, because a lot of those things, we've already talked about the antimicrobial resistance that we've developed with those, but a lot of the ingredients in these are actually super caustic to the skin itself. Chlorhexidine is a really common ingredient in a lot of these. And I'm somebody that's super sensitive to chlorhexidine. If I get it onto my skin, I get a burning rash, and I can feel it actually burning the top layer of my skin. And so if you start using these products every single day on your horse to try to get rid of it, you will actually strip the layers of skin.
Yes.
And you can make a very simple infection so much worse.
Yes.
So much worse.
And you don't realize the drying effect.
Yes.
And when I really understood this, when I started doing a lot of surgeries, when I was in Kentucky doing a lot of surgeries, we were constantly scrubbing in with chlorhexidine. And I have blacksmith hands.
Yeah.
Been a farrier for 20 years. I even noticed dryness in my hands. And I remember my wife talking about scrubbing in surgery, and she lucky they had made Avogard that had a moisturizer in it, because her hands were just so dry.
Yes.
This stuff will dry the heck. And like I said, I have calloused blacksmith hands. Chlorhexidine dries it out.
It's tough. It is a very, very powerful ingredient. And that's even at some of the lower percentages too. So a lot of the ones that are in shampoos are only a 1%.
And if you think chlorhexadine's bad, its cousin betadine.
Oh.
It's harsh.
Betadine is worse. Betadine is
harsh.
So much worse. Yes.
And I know it seems like we're making a big deal out of this. We're actually not making a big deal. We're just telling you straight. These things are harsh.
Yes. So you have to be very careful with those. So for a lot of these, if I have a horse with a pastern dermatitis that we're working on, I'll tell the owners we can use these chlorhex-based shampoos, but no more than twice a week.
At most.
At most. A lot of times you give them one clean and you've done all you need to do.
Right.
And every cleaning after that, we're going to switch to something gentle and calming and something that's not going to be stripping the skin barrier. So my go-tos are ivory soap and palm olive.
100%. Cannot. If you look in our trucks, what are we cleaning with?
Ivory soap. Ivory soap.
Your grandma was not wrong. She knew what she was talking about. There's a reason Grandma had ivory soap everywhere, because it worked. It
works. It does the exact same thing, and it actually leaves that, that oil barrier intact. Oils are very important on the skin.
That's what we all learned in the commercials. And everybody listens to this podcast, you watch stories with your grandma, okay? We all watched stories with her, so we all saw that commercial for Palm Olive where you do a sink full of dishes and without drying your hands. Y'all know you saw it, so don't pretend like I'm making this up. But the reason is it doesn't strip oils, and there's a reason ivory is so gentle. You can use it in babies. It's not drying that skin out.
Correct. So that's what I use for my everyday cleaning. And we can use that for wounds. We use it for the dermatitis. We'll use it for rain rot, which we'll talk about in a little bit later in this podcast. So.
And I think the most important thing to remember is people think it's that you're leaving this compound to actually do the killing, but when you're washing, it's the physical removal of bacteria. It's the scrubbing of it that physically dislodges those bacteria and removes them. It's not so much about killing them, because if we can dislodge the bad stuff, let our good guys get in there and fight the battle, that's what we're trying to do.
Yes.
It's the good guys getting in there fighting that actually win. It's the good bacteria that get back in there that help cure this. It's not just killing everything. Because if you kill everything, even the good guys,
they can't get in there.
Then the bad guys are going to just take over again. You gotta have good guys in there. You got good bacteria. They got to be there.
Clipping the hair is also very important back in this area too, because hair, especially horses with much longer hair, all that is just space for these bacteria to continue to hide.
Well, I think one thing to remember when you're clipping that hair is you don't need to, granted, we use 40 blades when we're clipping for ultrasound. It's probably not the best thing to clip that close.
No.
Because that opens up the hair follicles to allow infection in there and folliculitis. So I always say clip when you've got the long hair.
Yeah.
And don't shave it.
No.
Don't shave it.
No, not that bad.
Yeah.
Cellulitis too. You'll get a little cellulitis in there. So
folliculitis, cellulitis, it starts running rampant.
You don't need that, but so that's kind of our very simple approach to scratches. Again, super common problem. Some of these ones, if they are a little more chronic, if we're dealing with it in multiple feet, or it's been going on for a while, we will throw some systemic antibiotics at them.
But I think the biggest thing to remember is if you get this, reach out, get help, get on this quickly and fastly. Start kill. I always like to say I like to kill mosquitoes with sledgehammers. But again, let's get to it when it's a mosquito. I want to kill mosquitoes with sledgehammers, not kill a T-Rex with a nuclear missile. Granted, we're going to overdo it, but let's keep it at the mosquito stage.
Yes.
So when you start to notice this redness, swelling, sore, painful to touch, let's jump on this now. Not, I got a leg that looks like an elephant, I got 105-degree fever, and my horse is non-weight bearing. We waited too long. So.
And now we're on an uphill battle. So.
Yep. Early intervention. Get on this quick.
Yep. So.
Soap and water.
Yes. Soap and water are your friends.
Soap.
They're
good brush.
tried and true. Yep.
Oh, we'll talk about that in Rain Rot. All right. As you can tell, we get passionate about this. Like, of all things, dermatology.
But it's
the largest organ on the body.
It is, and it's probably the most common problem that we see, because it
Yes.
doesn't matter, whether you are doing preventative med or lameness or surgery or whatever it is, it affects every horse of all disciplines, of all
Yep.
breeds, ages, everything, and we see it all the time.
From now till October, may the derm be with you.
Yes.
But,
yes.
good thing I like it. Good thing we love it. That's all I got to say.
I was going to say, if you don't like it, then, it's going to be hard for you to avoid it.
Move to California. If you don't like it, move to California, because I don't think they have derm issue. I had a vet here years ago from California, and he worked here for a couple of years, and he had another one from Iowa, and they had no idea skin was this big of a problem. I was like, you better get good at derm if you don't live in Georgia.
It's because we live in a petri dish.
We truly do. All right, let's move on. What are we talking about next?
Rain rot.
Rain rot.
Rain rot. Everybody's least favorite.
What's the big name for that? Old dermatophilosis.
Dermatophilosis.
Congolensis.
Oh, rain rot. Rain rot is I feel like rain rot is one of those things that it sees us a lot more than we see it.
Yes, until it gets really bad.
Until it gets bad. But it's just...
It's like a giant overgrowth. It's when normal flora gets messed up over the entire body, and you get this huge overgrowth of pathogenic bacteria. And honestly, I think these are ones we never see it primary. We see it after it's been treated for 1 to 2 weeks. Mm-hmm. We're always seeing this after we've already tried everything. And there's some things that I have seen. This is where the chlorhexidine, like I've been dumping straight chlorhexidine. I've been giving him a betadine bath, dumping straight betadine every day, twice a day. My favorite, like Listerine was a deal. It was all over the internet.
Yes.
Listerine.
I've heard that. I've had some old school people tell me that, and I'm like, what?
Dump Listerine on a cut and see how you feel.
Because that's the thing. This is painful.
Yes.
These lesions, the typical kind of lesion is called a paintbrush, because when you pick them up, there's like little pieces of hair with the skin, and it looks like a little paintbrush.
Right.
If you start peeling these off your horse, they might turn around and try to bite you in the face.
True.
These things are painful.
Yeah. This is a nasty skin infection that is taking over the body. And like I said, most of the ones we see, they've been going for a couple weeks. So we've put the betadine on there. We've put the chlorhexidine. We've dumped, like I said, Listerine. We've dumped mineral oil on them. I'm trying to think of some.
All the lotions and oils
potions.
And everything. I've seen some where they've dumped oil on them,
Yes.
and then the horse got like a secondary sunburn from all of that. And I was like, oh, homie's going through it.
And it's like you've got this nasty, and they're painful, and like I said, they're absolutely miserable.
Yes, and I think, they're not just limited to the back either. Like, we think about the back, but, I've seen them on the face, I've seen them on the legs. I mean, it's anywhere that you've got just this moisture that just gets trapped. And I think your classic horses are these ones that they're outside, they're getting wet, they're not really drying off, they're getting wet again. So
when it's hard, like this time of year, we got horses shedding, and so they're trying to shed out, but they've got this secondary coat. Or like this week where you've got blankets on. You needed a blanket on if you had a clipped horse, you needed a blanket on it Monday. But by Monday afternoon you didn't. But then Monday night you did. But then by Tuesday morning you didn't need it. And so there's this constant fluctuation in temperature, and then the humidity levels are changing. They're trying to, some horses are trying to shed. So and a lot of times you don't see it until they start to shed out, and they're like, oh. I couldn't see this through all the hair.
And this bug is contagious too.
Yes, it is.
Extremely contagious. So one of the common problems I've seen is you started in one horse and you're grooming that horse, you're using all your bathing tools, maybe coolers, saddle pads, what have you. You use that equipment on another horse and now you've spread it to the entire barn.
Right.
So one of the biggest things when we talk about with this is disinfection on and that's everything. Grooming tools, blankets, saddle pads, everything gets like bleached, washed in hot water, everything. And I think a lot of people are usually surprised by that. They're like, really? It can spread that bad?
It absolutely can.
Oh yeah, and this is a hardy bacterium too. This thing can live on some brushes for a minute.
Yep.
So Mike, if you've got a horse with any derm problem, they should have their own set of grooming tools and everything. Do not use grooming tools between different horses.
Yep. And the other thing is to remember, if you're going to be disinfecting things like using the bleach solutions to disinfect, make sure you remember, I think it's a 16-to-1 dilution.
Something like that.
But make sure you look up the dilution and remember, less or more isn't always better. And that's very, very true with bleach. Like there's a magic ratio, I'm pretty sure it's 16-to-1, where you don't want to have it too concentrated because it actually doesn't work as well super concentrated as it does not. And I'm a bleach guy. Like I love to walk in and like, I smell bleach. This is clean. This is great, you know? And I have to remember, like, Dan, that's not the way the bleach works. So, but yeah, and I'm going to tell you this thing, we can be very successful treating this. But this is going back into those, this is going back into that stepwise approach. Identifying what it is. It's not a fungus.
It's not a fungus.
It's not a fungus.
Nope.
I actually culture quite a few of these.
Really?
Like if I've got some of these that are ongoing, I've actually cultured quite a few, and most of the time it comes back as some kind of a staph. Some kind of a staph pyoderma, but it's been amazing over the years how resistant these things can be.
And a lot of them too, like, you know, kind of circling back to what we've talked about, because people are scrubbing them in, you know, all of these anti-everything shampoos, you create a secondary infection.
Right.
And that's a lot of times where the problem comes in. It's not necessarily the original rain rot itself.
Yes.
It's that secondary infection.
Well, especially when, like, I do all I can not to put these horses on a systemic antibiotic, because it seems like we put them on that systemic antibiotic. Well, you're going to get systemic antibiotics even kill bacteria living on the skin. And so you put them on. That's why babies get thrush when they've been on antibiotics. They talk about babies getting thrush secondary to being on antibiotics because we killed that good bacteria because of the antibiotic. And it's the similar thing to horses where we put them on those systemics and we actually start to kill those good bacteria on the skin. And now the bad ones get worse. So we try not to get into that. In fact, usually I will culture before
you start it.
I start a systemic. Because I want to know what I'm dealing with. Because again, we're not getting this first. We've had multiple treatments.
And that's where, and this is a whole soapbox I can go on, is the thing that drives me absolutely nuts is when you see these giant bottles of SMZs in people's, you know, tack rooms, and they're just, you know, throwing a couple SMZs to a horse for about 2 days to get rid of, you know, the rain rot or the scratches or whatever it is. Clears up a little bit, and then they stop after the horse has only been on it for a day or two.
Right.
And I'm like, please stop doing that.
Yes.
Please.
Well, and the thing is, it wasn't even the SMZs that cleared it up. It was the bath he got.
Yes.
And again, like, I can't, I won't say this again. This is how much I believe in this. If you see rain rot, this is not the time to grab the gallon jug of chlorhexidine or the gallon jug of betadine you got down at the Tractor Supply or your nurse friend hooked you up with from the hospital. This is not the time to grab that.
No.
Like if you really and truly watch, I think the only time I'm grabbing a disinfectant like a chlorhexidine or a betadine, if I'm scrubbing for a joint injection, if I'm scrubbing to put a catheter in, if I'm scrubbing to do surgery.
Yes.
Other than that, I seldom reach for a disinfectant. So don't, because these, again, you know what? Next time somebody gets hurt, you get a nasty scratch, start treating yourself like you would your horse. See what happens. And I've done that because I wanted to know. It don't go well. It hurts. Chlorhexidine burns, by the way.
Yeah. Oh, it does.
It burns.
I feel bad for my horse that I scrubbed it like every single day for weeks with betadine. I'm like, I'm so sorry. I wish I could bring you back.
I remember before vet
Before
school, I thought like everybody else. It's like, oh, you give them a betadine bath.
Yeah.
And I'm out there bathing them in betadine every other day. And I remember looking, I was like, I wonder at what point this actually starts to work. Mm-hmm. Because it never worked.
And you're like, the horse should have kicked you in the head.
Yes.
Like, I know. Like,
yes. So.
Oh, I'm sorry, Riblet. Scrubbed you with that for like a month straight. I'm sorry.
Thinking about old Levi, and I'm out there scrubbing him with betadine. I'm like, because I had the old gallon jug.
Yep, same.
My mom was a nurse in the hospital.
Mm-hmm.
She brought me this expired jug of betadine home. I'm like, oh, heck yeah. Like,
that and the little curry comb, and you were just
dang
like,
right. I'm in there scrubbing him down. And I get to vet school, and I'm like, oh. You're not supposed to do that.
Yeah, but nobody ever told me.
No.
But I learned that from somebody in my barn.
Yes.
Who probably taught it to other people, and then they learned it from somebody else.
Yes, and it goes back to whoever invented betadine.
Yeah, I never talked to a vet when I was growing up.
No, I didn't even know there was one around. Because we just didn't have any where I lived. So, there's one vet in the county. And he wasn't coming up. Mm-hmm. So, yeah. And this is also, when we're talking about rain rot, and we're talking about, like, again, we're going back soap and water. Mm-hmm. I'm a palm olive and ivory guy, soap and water. Mm-hmm. And this is also where I talk about brushes from the standpoint of scrubbing. Mm-hmm. This is like the Goldilocks of brushes. You don't want it too stiff. You don't want it too soft. You want it just right.
Just right.
My favorite thing are actually those grooming mitts.
Yes.
You know, the ones like the rubber bristles?
Uh-huh.
Those things are absolutely perfect because this is where we want to exfoliate.
Yes.
They're like those little scrubby mitts are like the loofahs of the horse world, you know? We're going to exfoliate because that, again, we're talking about physical removal of bacteria, but we're also talking about physical removal of the places those bacteria hide.
Yes.
The paint brushes.
Yes.
I love those mitts. I want a good lather on there. I really want to scrub it really, really well. Mm-hmm. And people always ask about those scabbies. Like, do I pick them? Do I not pick them?
I like to leave the scabs on. I say the scab is the body's natural Band-Aid.
Yep.
So leave them on when you can. A lot of times when we are sampling, we will actually take some of the scabs because sometimes there is some evidence of, where our bacterium was.
That's what I
infection or everything. Yeah, we love the scabs, but I prefer to leave scabs on if they're there.
I always say when that little exfoliating rubber mitt, when it removes them, when it exfoliates them off, then it's
ready to come off. Yeah, but if you have to sit there and physically pick it off, it's not ready. Leave it alone.
And
I know it's tempting,
bleed when it comes off. It shouldn't bleed when it comes off.
Correct.
It should be a nice scrub, and it should just come off with a little scrubby exfoliating mitt.
Yes.
So.
And exfoliating, you do still want to be careful with it. Like when you're dealing with an active infection like this, yes, it's important, but your horse does not need that every single day.
No.
And if you do this every day, you can actually further disrupt this barrier. So when you're dealing with an active problem, yeah, we love exfoliation. We love doing that, but not for everyday, routine maintenance on everything.
And this is one of those things that my first line of defense is seldom a medicated shampoo because I've got a systemic problem here. Usually I will try the soaps and waters in a good bath first. And I'll usually recheck these horses in about 3 to 5 days. If we're not getting better, then I will reach for an antibacterial soap. I've got one that we sell here. It's a combination. It's a chlorhexidine, itraconazole. It also has, and I'm probably going to butcher how you say it, phytostigmine in there, but it's a skin moisturizer. So when that chlorhexidine and betadines, they dry the skin, actually cause cracks and breaks in it. And those are great places for bacteria to hide. The phytostigmine actually keeps that or minimizes how much that happens. But I tell people there's a right and a wrong way to use that. Like when you put it on, this is typically a one-time use. Like this is one-time use, guys.
Yep.
I want to lather it in really, really well. All right, put it in really, really well, and then I want to let it sit.
Yes, contact time.
Contact time. I would say 7 minutes. The reason I say 7 is because I really just want 5. But I get impatient, and I figure everybody else does too. So, 5 to 7 minutes. So if I say 7, then because usually I'm over there like, is it in 5 minutes yet? So if I do 7, like if I wash it off early, it's still fine.
There you go. Exactly. And yet washing everything off, make sure you get all of that removed. Because again, a lot of those ingredients, that chlorhex, that can be caustic if it sits on there. And then drying. drying is probably one of the most important steps in this, because it's that retained moisture that allows a lot of these bacterium to continue to propagate.
Sure.
So, make sure that we are drying the leg off. Blow dryer works very well if you have a horse that is very feathery down there. A lot of my show barns that have feathered horses, they have giant blow dryers. And every time these horses get a bath, they are getting blow dried.
Fans work really good too. If you're doing the entire body, get some good fans going on you. Because you're 100% right. You've got to thoroughly dry these horses.
And that's where a lot of these issues come in is, horses outside and they're out in the rain or the mud or whatever, and they're just constantly wet. Making sure we're getting them dry is so important.
Especially on those pasterns, going back to that pastern dermatitis, because people want to put a topical medication on. And one of the things I tell people is if you're using an emollient, and emollients, there's a couple different bases in a medication. One of them's a zinc oxide base. That's sunscreen. And then you have an emollient, and that's like an A&D or a diaper rash. This is stuff that feels a little more oily, that when you put it on is like there. And I tell people, when you're going to use an emollient, you have got to make sure that skin's really, really dry.
Yes.
Because an emollient's made to keep moisture out, but it's not like a one-way valve. It can actually trap that moisture in. And sometimes we want to trap moisture in, but we don't want to trap excessive. And so when you're going to use some of these topicals, especially the emollients, you've got to have that area very dry. And even with the zinc oxides, you got to have it dry, because we know, like, if it's wet, you have to reapply sunscreen constantly. And if it's because it's washing off. And so when you're using these topicals, like I said, usually they're one of two bases. They're either a zinc oxide base or an emollient base. And when you're using that, you've got to have dry skin.
And then the kind of classic question is, do I bandage it? Do I leave it? What do I do?
All right.
Yeah. My rule of thumb is if you have open wounds, keep them bandaged. Keep something over it.
Correct.
Because any sort of open wound, that is a medium for us to get an infection in there. And that's where we start to see our cellulitis, our folliculitis, some of our nastier things come in. I say if you can keep it dry, keep it open.
Right.
Keep it open.
And that's paying attention to your conditions. Like if you're dealing with this, we need to be careful about it. And I'll tell you one other thing on going back to rain rot. I just thought about this. Turn out, not turn out. One of the things people forget is if you have horses with white legs, I guess I thought about this because of wrapping. If you've got horses with white legs, if you have horses like paint horses that have white on them, if that skin's not pigmented and you do get a pastern and you do get one of these dermatitises, the other thing that can happen is you can sunburn. Solar dermatitis is the fancy name for sunburn. And so you end up with a secondary solar dermatitis or secondary sunburn after they've had a rain rot. I see this mostly on legs that have had like scratches, especially going up into the cannon bone area. But you'll look at them, they're red and they're inflamed. And it's because we've had some hair loss. We've had these open wounds. Now we're getting sunburn because this is non-pigmented skin. It cannot tan. And so we get these secondary solar dermatitis. So you start off with a bacterial infection, then you get the secondary solar dermatitis. Now your horse is really hurting, and with it, and everything's really inflamed, and now we've got this whole cascade of events. And so pay attention. Like if you have these areas and it looks like you're seeing some redness in that skin, this might be a horse we need to keep up during the day and out at night. Now, I say that because most of the time we want these horses out when there's sunlight, because sunlight is a fantastic antibacterial.
Yes, it is.
UV rays will kill the heck out of some bacteria. But if you're getting a sunburn secondary to these infections, we need to think about shading these horses.
And again, that's where, being very diligent, one thing that I love with derm is pictures and a journal.
Yes.
Those are fantastic resources to use with your horses, because again, every horse is going to be unique.
Right.
Every horse is going to have their triggers. Every horse is going to be more sensitive to some things other than others. So, keeping pictures of if your horse has a lesion, what does it look like? Keeping a journal of, okay, what was the conditions like today? Was it super rainy? Like, did we have a big, drop in cold, or was the UV index super high? All of these things can be like really, really helpful for us trying to figure out what these horses' patterns are, how can we treat it, and then how can we manage this going forward.
Because that's the thing, is most derms are not single problems. They're multifactorial. The other thing I'll throw in there is older horses, chronic dermatitis, chronic bacterial dermatitis, older horses, I do start to think about Cushing's. I know it seems like everything goes back to Cushing's, but in these older horses, Cushing's plays, the pituitary gland plays such an important role in the body. And when there is that dysfunction, a lot of things get messed up.
Yes.
And if I've got some of these older horses, chronic dermatitis will not get better. I'm looking at checking them for Cushing's.
And that's where a lot of these fungal infections actually come into play. Most of the horses that I do diagnose with a true fungal infection, there's an underlying Cushing's component.
Yes.
Because it's so difficult, I think, for fungi to take over like that, unless we've got a bunch of other issues down the line. But it's these ones that have an immunocompromised, issue going on, that's where the fungi come in.
That's what I was going to say, is like, when it actually becomes fungal, it's one of two things. Either it's something with the horse's innate immune system. Cushing's is a good example, where they're immunosuppressed secondary to Cushing's. There's some type of immunosuppression going on that allows the fungus to take over, or it's man-made.
Yep.
We've hit them with so many topicals, we've hit them with so many chemicals that we have killed off, like we have sterilized the skin. And now because fungus don't, you can outcompete a fungus.
Yes.
Bacteria can outcompete a fungus.
In a normal circumstance.
In normal circumstance.
Yes.
And it's when we wipe out all the good stuff that these true fungal infections start to grow. And one of the things you hear all the time is he got the ringworm. I have looked for ringworm. I've seen it in one, maybe two horses. And we're talking about out of thousands of derm cases. Ringworm just don't happen that often. And if you are dealing with a fungus, that, again, that's where the cultures come into my mind. If I think I'm dealing with that, I'm getting these cultures out. The lab will tell me, hey, you got a fungus. And also the other thing is, I'm big on skin scrapes.
Yes.
I love to do a skin scrape, look at this under a microscope. If there's a fungal issue, we're going to see it on that cytology. We're going to see it there. So the other thing I'll throw out there, and we're going to get into this in another podcast, is the number of immune-mediated skin conditions that can also present and look very, very similar to scratches and dermatophilosis or rain rot. So some of these, that's why rain rot may seem really simple and is most of the time, but like I said, you start really getting in the weeds of it, there's a lot of other derm things that can look a lot like rain rot and scratches.
And that's why it is, it's important to bring these things up to us.
Yes.
Again, I think we see a lot of horses that, they've got rain rot, they've got scratches, they've got all these things, and the owners are just kind of dealing with it on their own. And a lot of times that works.
Yeah.
That's fine. I'm not going to, sit here and worry about it. But if you have your horse and they seem to be constantly dealing with these issues.
Right.
And we've done all of the things, we're doing everything correctly. We're not, slamming it with the chlorhex and all the things. We're trying to do our environmental management and things aren't working. That's where we do need to get involved.
Yeah.
And start doing a little more investigation, because that's where we could have something a little more involved, like a deeper, pyoderma or folliculitis. Right. Or, an immune issue or Cushing's or a fungus or something that's just something that just isn't typical. And
that's where it goes back to that other podcast we did, looking at these derm workups. So, we were doing the skin scrapes. I love doing cultures. So usually, if I get called out, I'm looking at derm. It's been going for a while. we're doing basic blood work. Mm-hmm. I'm trying to look at the overall health of the horse, systemic health. I'm doing a skin scrape. I'm doing that culture and sensitivity. In some cases, I'm going to say, let's get a biopsy. Mm-hmm. And we're going to grab just a small 10 millimeter punch biopsy, get that to a pathologist, see if there's another underlying condition. Because I'll be amazed. I'm always amazed at how many of them will come back. And we're dealing with, a pemphigus. We're dealing with a nodular necrobiosis. We're dealing with some of these immune-mediated skin conditions. Mm-hmm. And they can help. The pathologists help a lot. You give them history, and I love pictures too. Mm-hmm. Like, I will upload these pathology reports, and I'll include pictures with it, great descriptions. Like, get your pathologist the information, and they can. Those simple tools can be so helpful to figuring out what's going on here. Mm-hmm. And I think they're invaluable from a derm workup.
Oh yeah. Well,
all right.
That was a fun one.
Yes, that was exciting. Derm may always seem like a boring deal. I mean, nobody ever meets a dermatologist like, oh, you must save lives. But really and truly, like, dermatologists, they're kind of the unsung heroes because they do take care of the largest organ of the human body and your horse's body.
Yes.
And is the first line of defense, as we've talked about before. It's the first line of defense for good life and for health. So another great episode.
Yeah.
Enjoyed it. I love dermatology. Mm-hmm. It's a lot of fun.
Everybody loves dermatology.
I think as you can see it.
Yes.
With lameness, you're always having to image with like some piece of equipment, x-rays, ultrasounds. But derm, you get to look at and you get to see your progress. Mm-hmm. So I think that's why I like derm.
And again, it's so common. It doesn't matter, what types of horses you see, breed, age, discipline, or what type of work you're doing. It's everywhere. It affects everybody,
especially in the Southeast.
Yeah.
Like, this is derm land.
This is derm land. Yep.
I remember getting out of vet school, like, I wish they taught me more derm. Mm-hmm. Like, and I was lucky because I actually had, I'm gonna give her a shout out, Dr. Susie White. She was at the University of Georgia when I was there. She taught an equine dermatology class, and I used to help out on her farm. I trimmed her horses. I would bush hog out there, fix fences, and she was always teaching me derm. Mm-hmm. And the lessons I learned from her, Dr. White, if you're listening, thank you. Thank you. You taught me how to do a proper derm workup. You taught me about dermatology. I cannot thank you enough because it's really been invaluable. Mm-hmm. So, want to give a shout out to her because she was awesome. Thank y'all for tuning in. If y'all have got other episodes, and y'all been great, like our whiteboard keeps getting bigger and bigger, and we were trying to get through them all. But, there's just a lot of stuff to cover.
There's a lot of stuff.
And we got a lot of great ideas. We promise we're getting to them. We promise we're getting there. It's just, we're going as fast as we can. Mm-hmm.
We need another whiteboard.
I know.
We need another one. The one that we've already filled up 2 whiteboards of topics. And
I know, and
they keep coming in.
Yeah. So thank y'all for listening. Thanks for sending the ideas. If you got more, give us a call, send us an email, text us, DM, Facebook message.
That's majority of them.
Yeah, carrier pigeon, write a letter. Snapchat. Do we have Snapchat?
We don't have Snapchat.
Yeah, we don't snap. I think it covers all our communication ways. Anyway, just send us some ideas, and then there are people that we see out in the field, and they're like, "Hey, can y'all do an episode on this?" Mm-hmm. So it's really awesome. Thanks y'all for tuning in, and we'll see y'all next week. Thanks for being here, Dr. Brown. Take care.